This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and welcome to Your Health. I'm Barry Morgan. The topic of this podcast is something many people can relate to: screen addiction. Whether it's a cell phone, a tablet, a desktop computer, laptop, TV, there are screens virtually everywhere these days. A new study says the more time that kids spend in front of a screen, the more attention deficit problems they could have. For example, the study says 5-year-old kids who spend more than 2 hours looking at a screen per day are 7 times more likely to show signs of ADD or ADHD than kids who spend less than 30 minutes per day. Statistics also show that 1 in 5 Quebec adolescents spends 35 hours a week or more in front of a screen. Parents and caregivers have their hands full. So what can be done? Dr. Paola Habib is the head of child psychiatry at the Jewish General Hospital, a member facility of Centre-Ouest Central Montreal. Doctor, thank you for being here. And would you call this a crisis?
Hello, Barry, and thank you for having me today. Yes, I definitely would call this a crisis. I think those numbers seem huge. 35 hours per week, this is really a big number. I would also say it's a crisis because it's definitely something I get asked about a lot. If it's not only in my clinic, but also, from friends, from other parents, it's definitely a hot topic.
How much screen time is really too much? Can you break it down by age groups? Like, what is there really an appropriate amount of screen time for kids at specific ages?
So if we look at the Canadian Pediatric Society recommendations, they really don't recommend any screen time before the age of 2 years. Now, between the ages of 2 and 5, they recommend to limit to up to 1 hour of screen time use. And after the age of 5, they recommend to limit to up to 2 hours of screen time use. So in my opinion as well, I think maybe we can also make an exception for video chatting and apps that use similar technology in order to be connected to important family members who are abroad or who are out of town.
That's
but also
the only way to see
within
them.
reason, of
Sure.
course, exactly.
Yeah, but zero screen time for, say, a 1-year-old, like not
Zero
even
screen time.
videos, like those educational videos.
Not even those,
Wow.
not even those, yes. Because, they've tried to look at that, and the verdict is out as to whether these babies are really benefiting from these apps at such a young age. I think when they're a little bit older, they might benefit a little bit more from educational content, but before the age of 2, they should really be spending more time, interacting closely with their primary caregivers, really building bonds
Sure.
and meaningful relationships. That's important for attachment.
So really, even for a teenager, 15, 16, 17-year-old, cap it at 2 hours.
Cap at a 2, even though it's tough.
It is tough.
With the 35 hours per week that we just heard about.
Well, that's how frightening is that to you to hear a statistic? Maybe I should repeat it just in case. 1 in 5 Quebec adolescents spends 35 hours a week or more in front of a screen just to, take their minds off the issues of the day, I guess.
Well, it's really frightening because for us, the real problem is, what is this replacing? 7 hours a day is like a full-time job, right?
No kidding.
So what is it replacing? Is it replacing live interactions, establishing meaningful relationships, social interactions? And a lot of the children I see tell me, well, I'm still connecting with people. Whether it's through social media, whether it's through playing video games and connecting with other players when I'm playing these video games. But I always say, well, it's not the same. It's still not replacing live interactions, and that's very important for their development.
They're actually isolating themselves, aren't
exactly. That's how I see it. Yes. I really think it's way too much.
So, and that leads to the next question, Dr. Habib. So what are the effects of too much screen time? And I mentioned that study earlier. Does it make kids more susceptible to things like ADD, ADHD, behavioral problems?
Well, it's part of a problem, right? So it's part of a problem of not setting limits, part of, like I was just saying earlier, or replacing healthy habits by non-healthy ones, right? I wouldn't necessarily make a direct connection that screen time is definitely causing ADHD, but I would say that, it's definitely causing many problems. There were a lot of studies conducted that are trying to look at all this. And some of those studies are showing, for example, that too much screen time, and we're talking here more than a couple of hours, a day, for infants that are very young, so below 1 year of age, can affect the development and can delay language development.
Okay.
So can delay it. Sometimes it can affect, the ability to sustain attention, cognitive abilities, and also more importantly, because it's replacing very healthy habits, it can be tied to obesity. Because it's promoting a sedentary lifestyle. If you're spending hours on a screen, sitting down, you're not taking walks, you're not playing outside.
Sure.
It's really not healthy.
Any other potential long-term effects, Dr. Habib?
To follow on what I was just saying, with the sedentary lifestyle, when you start developing healthy habits when you're young, and again, the sedentary lifestyle could lead to obesity, weight control problems, unhealthy eating habits. Of course, when you're having a hard time establishing and maintaining relationships, that also will have long-term effects because you start to learn these skills when you're very young.
I'm thinking of a kid who's spending all these hours in front of a screen, and even if they devoted one of those hours to, say, playing soccer, how much different that would be over the course of 5-6 years in their life.
Yes, of course. That would be very, very important.
What kind of, and I know you have some tips, which is terrific, although not one size fits all, but I know you do have some strategies, and when families come to you, what kind of counsel do you provide? What kind of suggestions do you have?
So I think the most important thing I would say is, or one of the two most important things is, one, don't be afraid to set limits around screen time use, and don't be afraid to talk to your children about it. This should prompt a good family discussion about pros and cons, and be honest with your kids, and tell them about why you're worried about screen time use. The other very important thing, in my opinion, is you have to really model what good screen time hygiene would look like.
Great idea.
By nature, screens can be, they can have like an addictive quality to them because they do offer you a multisensorial experience. It's very engaging, it's very entertaining. And we're talking about, smartphones, TV, that includes, it's included as well, tablets and all kinds of screens. And you have to start by yourself. We spend so much time on our phones, whether it's because of work, sometimes checking emails, or whether it's social media and other things. And kids do see that, and they will call your bluff if they notice that, you're telling them to limit, but you're spending so much time on screens instead of actually talking to them and interacting with them.
Should there be screen-free zones in the house, maybe certain hours of the day?
Sure. I think it would be a great idea. Maybe starting with establishing some rules together, like screen time free zones, or free moments, like at dinner time,
mealtime,
and other important moments. But also, I think you could benefit from making it fun as well. You could maybe play a game, like at the beginning of a meal time, for example. You can bring a basket and everybody places their tablet and smartphone in the basket, and then you can see who lasts longer without reaching for it. You also have to make sure that you're replacing the screen time use by something fun and entertaining for the family, a family activity, for example. It could be as simple as taking a walk outside or around the block. Could also be, playing board games. And the other thing I would say, we're not saying that screens are completely bad for you. Yes, as you mentioned before, sometimes there are some educational games, educational content that could promote and help, learning when they're older. Obviously, we're not talking about below 2,
right?
But later. And sometimes, it could be also fun to watch a movie together as a family. But whenever you see your child using screens, maybe try, and I know it's hard sometimes, but then try to take that as an opportunity to actually spend time together and make it also a quality time together, so that you're discussing together, you're also monitoring the content, making sure it fits your family values, making sure that there's nothing inappropriate you see. And if there is something inappropriate, you can immediately then discuss it with your child and talk about why it was inappropriate.
At least if you're watching a movie, the whole family is together,
Exactly.
You're laughing, hopefully
Yes.
laughing together,
Yes.
engaging with other human beings after all,
Yes.
but in person
Yes.
together.
I think the take-home message is that it's not necessarily screens that are absolutely bad. It's what you're not doing when you're fully on screens. So the time you're spending on screens, if you're also making it a quality time, that's a supervised time, I think that's being fair.
Perfect message right there. Dr. Habib, thank you very much for your time.
Thank you for having me.
Dr. Paola Habib is the head of child psychiatry at the Jewish General Hospital, a member facility of Centre-Ouest Central Montreal. And that's it for this edition of Your Health. Thank you for joining us. To hear our previous programs, you could find them at podcast.ciuswestcentral.ca. That's podcast.ciusswestcentral.ca. And let us know if there's a topic you'd like us to explore in the future. I'm Barry Morgan. Until next time.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.